I am Carrie Ryman. I'm a certified nurse midwife, and I have with me today Dr. Danielle Fishel. Danielle is a board-certified chiropractor specializing in pregnancy, postpartum, and pediatric care. She's been practicing since 2018, and her office is located in Crestwood. Today, we're going to talk a little about chiropractic care in pregnancy, and we're so glad to have you here, Danielle. So let's jump right in.
Thank
So
you.
if you
Yeah,
could,
thanks for having me.
yes, we appreciate your time. So tell me a little bit about your experience and your subspecialties. So what's the focus of your practice?
Yeah, so it's kind of funny because I went to school and I learned like my bread and butter of like, low back pain, headache, neck pain, wellness care. And then I found myself really passionate about women's health and my pregnant mamas and babies and kiddos. And so I decided that I wanted to learn more about those populations. And so I see and focus a lot on pregnancy, postpartum care, and then newborn care and pediatrics. So I have a lot of people asking, like, do you see men too? And I'm like, oh my gosh, absolutely. That's why I went to chiropractic school. I see everyone. But I've just taken additional education in the, prenatal, postnatal, and baby kiddo world. So yeah,
And a lot of
absolutely.
people that come to see me ask about Webster, and they say, what is this Webster thing? What's Webster
Yeah.
chiropractic? Can you tell us a little bit about what that is?
Yeah, absolutely. So Webster is a specialized technique that we use for a lot of pregnant women. You can use it on anyone, but it has its claim for fame is throughout pregnancy using the Webster technique. And really what the focus is balancing the pelvis. And so I actually have my dry spine, if you don't mind,
Oh, that's great.
because I feel like it's so much easier to understand. But this is our pelvis, right? I'm sure everyone's kind of familiar with this, but there are a lot of different structures within our pelvis that can cause misalignments within it. And I always, I kind of use the analogy, and it makes a good sense, is this is your pelvic bowl, right? And this is where the baby's eventually going to go through. And so we want that to be like as round as possible. It would be a lot easier to push a baby through this versus this,
Right.
right? And so we balance the pelvis by addressing the joints, the muscles, and the ligaments of the pelvis. And through balancing those, we're able to help the nervous system function better. We're able to help mom have greater comfort throughout pregnancy. We see decreased intervention, whether that be C-section or use of tools through chiropractic or with women who use chiropractic care throughout their pregnancy. And we also see shorter labor times, which is like one of the things that my pregnant moms are so excited about. And the reason why we see that is because the baby is able to engage in the pelvis properly when it comes time to be born. So there's not as much getting stuck in that pelvic inlet as maybe if that pelvis wasn't aligned. So there's a lot of really great benefits to chiropractic care throughout pregnancy.
Yeah, and everything you just mentioned about lower C-section rates and shorter labors and just things going more smoothly, I see that in my own experience working with pregnant women. So that's why I recommend that all my patients or most of my patients see chiropractic care. And that leads me into the next question of, do you think that chiropractic care is beneficial or necessary for every pregnant woman or only if they're having aches and pains?
Yeah, absolutely. I recommend chiropractic care for every pregnant woman. And I actually get asked a lot, well, what if I'm planning on having a C-section? There's actually research out there that shows recovery postpartum is much smoother with chiropractic care during pregnancy. So absolutely, if you're pregnant, you should be getting adjusted, especially if your goal is to have a vaginal birth. It's really important to get your pelvis aligned and help create more space for your baby. I see a lot of women too, which I'm sure you've probably referred and many midwives have for breech babies.
Right.
Webster has a claim to fame for spinning breech babies to go head down. As a chiropractor, we don't spin the baby. We don't actually make contact with the baby. We just balance the pelvis and create more room for the baby to move and then eventually go head down. There's a really high success rate with that. But also, even if you have a baby that's head down or you're not having pain or you're planning to have a C-section, whatever it is, it's really beneficial to get adjusted throughout pregnancy for not only health during the pregnancy, but also postpartum.
And that's a great tip about the postpartum recovery. I wasn't aware that that research is out
Yeah.
there, so that's great for people to hear. When do you expect or want people to start their care? Should they start as soon as they find out that they're pregnant? Should they wait until they're in the third trimester? What's your recommendation?
Yeah, absolutely. I recommend starting as early as you can, just because there's so many things that are changing throughout the entire pregnancy. And I actually recommend starting when you're trying to conceive, because there's a lot that goes into conception work as well. So I do see moms and dads that are working together to try to conceive, that we are working on their health in general to help make sure that we have a really healthy pregnancy.
So you've laid out lots of reasons why it's best to start early, but let's say we have somebody who's resistant to chiropractic care for whatever reason, or just has not had it suggested to them before, and they find themselves in the third trimester and they're coming to the office saying, oh my gosh, I have this terrible pubic bone pain, or my back just can't, won't stop hurting. My hips are bothering me. How late will you accept patients? Or do you see people when they're already towards the end and just now starting chiropractic care?
Oh yeah, absolutely. It's never too late to start chiropractic care. I like to say, sometimes I say when moms come in, like at the very end, I'm like, okay, we're doing a Hail Mary. We're going to do as much pelvic work as we can in the next week to prepare you for this birth. And it's great that they're there when they are, and we'll do as much as we can. And like I said, a little chiropractic care is definitely better than both. But I do see better results with women that are getting it throughout their entire pregnancy, for sure.
So if you have one piece of advice, your best piece of advice for pregnant or expecting families, what would it be?
So my piece of advice would be start building your team, right? There are so many different providers that you can utilize throughout your preconception, your pregnancy, and your postpartum time. And making sure that you have those lined up is really important. And a really, really essential part of that team that so many people don't think about is who's supporting you postpartum.
Awesome. Thank you so much for that information. And if people want to know more about chiropractic care in pregnancy or postpartum or newborn care, how would they find more information out about your practice?
Yeah, absolutely. So I have a website. My website is fishelchiropractic.com. That's where you can learn about where we're located and a little bit about what we do. But I'm also on Facebook and Instagram. So my Instagram is at Dr. So Dr. period Danielle Fishel. And then my Facebook is Fishel Chiropractic STL. And I post a lot of great information on there that talks about all different things, whether it be chiropractic care, pregnancy care, newborn care. There's a ton of different things on there that can hopefully help guide someone to our office, but also just to learn more about how they can better care for themselves and their family.
Great. Thank you so much. And we will have all those links in the comments below so that people can have easy access. Danielle, thank you so much for your time today. We really appreciate you talking with us.
Yeah, no problem. Thank you so much for having me. I really enjoyed it, and I'm glad to help.
Thank you. Today, we had the pleasure of talking to Dr. Danielle Fishel about chiropractic care in pregnancy, postpartum, and the newborn period. If you'd like more information, you can look at the links that are in the description below. Thank you so much for tuning in.